So hi, everyone. I am here with Dr. Satbir Singh Khalsa, who I have known for many years and have done some presenting to dietitians before, uh, to great interest. And Dr. Satbir, thanks for spending this time with us. And I'm curious to hear a little bit more about your professional journey and really what drew you along with the yoga therapy interest. I know that you've done an awful lot of clinical research and really moved this field along. So I'm curious to hear kind of how that was for you personally and professionally as that unfolded.
Well, I think we probably have to go back to the early 1970s to really talk about my entry into yoga. I was interested in these spiritual states of consciousness, and yoga seemed to be a path that and a technology that would facilitate that spiritual development. And so um, I was fortunate enough to have a yoga course for credit offered at the University of Toronto at that time. And so that's what got me involved. And I had always been interested in science and research. And so um, a few years after I had been living a full yoga lifestyle in an ashram lifestyle setting, I had the passion to want to do research on yoga, to show the benefits, to show these changes that can take place internally, that inner growth, the emotional development, and performance improvement. And and so I set a goal of wanting to do research on yoga. And so I went back to college after my bachelor's and then got into a PhD program, earned my doctorate in neurophysiology because I wanted to study how yoga works essentially on the brain and on behavior. And so, long story short, I wasn't able to begin research on yoga until there was funding for it. And that didn't occur until 2001. At that point in time, I was a faculty at Harvard Medical School at Brigham and Women's Hospital. And the what was called then the National Center for Complementary and Alternative Medicine was finally funding full grants. And I was fortunate enough to get a research career award. But that was targeted at a clinical condition, which happened to be insomnia. I think it would have been very difficult to try and get a grant funded at that point in time on sort of basic research on yoga and how it changes internal functioning. So that's how I began, and other opportunities came up, and all of those opportunities in the early 2000s, in that first decade, and literally even in the second decade, really were targeted at clinical application of yoga. So I have to say that yoga therapy was not my original passion. Yoga and understanding how yoga works was my passion, but given what was available for funding, and in order to have a career in this area, the, the greatest chance for success was really to do clinical trials. So I ended up doing clinical trials of insomnia, clinical trials of post-traumatic stress disorder, and then into uh, uh, generalized anxiety disorder. I was also able to do some studies later on yoga in the public schools and yoga in the workplace, but again, targeted at clinical outcomes. So for children, it was, anxiety, depression, um, uh, and mood and stress. And in the workplace, it was similar, burnout and stress. So my career has largely been focused on the application of yoga as yoga therapy. Um, so that's really sort of the trajectory, and that has put me in close contact with the International Association of Yoga Therapists. I work closely there, and I'm the editor in chief of the International Journal of Yoga Therapy, and I also coordinate the annual symposium on yoga research. But now, as I'm moving more into sort of a preferred retirement mode, I'm starting to come back to being involved, at least as a co investigator or a consultant, on studies that might sort of probe a little bit more on how yoga works on transforming people, bringing people into these deeper states of consciousness, to transforming their life purpose and meaning, in what we might call, in a sense, pure spirituality. So that's kind of like my current focus and interest in the later stages of my career.
Well, and I know that you've always been supportive of the dietetic community. I know that you've spoken a couple times at Fancy, and I was there along with that. And as your research continues to unfold, and as you continue to see this whole field expand and grow, um, what are your thoughts for dietitians and those who really focus on nutrition related conditions, really based on what you've seen? So curious to hear what you'll be talking about a little bit at Posana, and what you see as the opportunity for nutritionists.
Right. And of course, you know, full disclosure, I've not conducted any trials on eating behavior or nutrition, but yoga and the application of yoga in the general population, one of the greatest applications of that is in its efficacy in preventing and treating non-communicable disease, NCDs, chronic lifestyle diseases. One of the major risk factors, as we all know, is dietary choices. And so in appreciating the role of yoga in modern medicine as a whole, I've come to a good understanding of how important diet is, and dietary choices, dietary behavior, and behavior change in diet is in terms of addressing these non-communicable diseases. And in relation to that, how yoga has a great potential in facilitating that kind of change. Now, given that NCDs are lifestyle diseases, they're non-communicable. They're behavior choices. These are lifestyle. And so the true cure for NCDs is not pills, it's not surgery, it's lifestyle change. And modern medicine is very poor at lifestyle change. The focus is really on guilt and fear. You get a laundry list of what you should eat and what you should do. And most patients don't have the resources to succeed. And they're driven by guilt and fear, that the fear that they're going to die or get more sick, and the guilt of failing and not being able to manage that behavior change. And behavior change is very, very difficult to initiate from the top down. In other words, I'm going to make this change. I'm going to lose weight. I'm going to eat vegetables. I'm going to stop eating sugar.
Right.
And that is a top-down strategy, which is not very effective, because it's an imposition, and people then rebel from an imposition like that. So the true success in behavior change is from the bottom up. People have to want to be driven into behavior change. So enter yoga and enter the meditative aspect of yoga, in which you are engaging the attention networks when you meditate and when you focus. And what happens to people when they start a yoga practice and continue a yoga practice over the longer term, they become more sensitive, they become more aware, they increase their mindfulness. They become very tuned into their bodies, their minds, their emotions. They become a little bit more masterful in knowing what's going on mentally, emotionally, and physically. And so what happens is that when they engage in a dysfunctional behavior, after they've gone through this transformation where they become more mindful and more mind-body aware, they now are aware of the negative consequences of junk food. So they'll go and eat a whole bunch of sugar or a whole bunch of refined foods or a whole bunch of fatty foods, and they'll notice that their body is just not feeling good. And so, and in fact, it's very intense because now they're more sensitive than they were. So that makes them think twice about ever doing it again. On the other side of it, they eat some vegetables, they eat some, very good salads, they eat some good food, and they notice how that makes them feel good. So now they're drawn to that behavior. And so this is behavior change from the bottom up, which means that it's sustainable. Your own reward mechanisms in your brain are actually working for you
Yeah.
in this dietary change. And so this is a strategy that has much more chance of success because it is from the bottom up. It's not a top-down imposed mechanism. It's a bottom-up, I want to do this mechanism.
Right.
And that's very important. So that's a very important component of yoga that can make diet change happen. Another area that yoga has a lot of relevance is in managing chronic stress. And we know that chronic stress has negative impact on virtually every function in the body. And there is also a negative impact on eating behavior. Stress-induced eating is well known. And so the more you can reduce the stress response, the chronic stress levels in individuals, the more you're going to move away from the negative impacts of stress on the central nervous system, on behavior, and that includes eating behavior. So that's another strategy where yoga is participating in helping people come to a better dietary regimen. And then finally, and this is sort of a secondary issue for nutritionists per se, like all healthcare workers, they're under stress. And the modern medical system is highly stressful. It's become a very dysfunctional system. As people know, people are experiencing high levels of burnout, and that includes all the allied healthcare workers, including nutritionists. So I think it's very important to have access to stress management practices, and yoga is an excellent stress management practice. And in fact, modern medicine doesn't have stress management. If it did have stress management, there wouldn't be the levels of burnout that we're seeing in healthcare providers. So yoga provides something that modern medicine and it simply does not have, which is a stress management strategy. So with yoga practice on a regular basis, you can become a more effective worker, less prone to burnout, less prone to chronic stress, and be more functional. And being more functional as a therapist or a nutritionist makes your patients succeed better as well. So it's a twofer, if you will. Becoming a better therapist means that your patient outcomes are actually going to improve as well. So I think it's a win-win from that perspective. So there's multiple angles in which yoga really has a lot of relevance for the field of nutrition and for dietitians and nutritionists.